Hi, so my name is Bay Whitney, and I will be presenting today about the Bailey Boucher House and its kind of place in the bigger picture of the Seattle AIDS epidemic. And so the Bailey Boucher House was an AIDS hospice facility, and it was the first one built from the ground up in the US. There were similar facilities built in harder hit cities like San Francisco and New York, but those weren't built from the ground up and they weren't quite the same as a facility dedicated solely to AIDS end of life care. And so in my research, I've been looking at the origins of the Bailey Boucher House, how it fits in kind of to the larger, impact of the epidemic in Seattle. The group that organized it just kind of came up with the idea, and they went full steam ahead for almost 5 years. And they were able to organize it, fundraise it, design it, network, find lots of donors. The fundraising is actually unique in that it had small private donors in the community and also some larger donors like Boeing and the Seattle Art Museum. So that is also an interesting facet of it. And my research has also been contextualizing the Bailey Boucher House in the larger LGBTQ rights movement and HIV/AIDS crisis, mostly in the US, but mostly in Washington State and Seattle. And so my argument that I've been looking at, I've been kind of taking a few approaches. I've been talking about how the Bailey Boucher House changed AIDS management and end of life care because this was one of the first AIDS hospice facilities in the US. That was really revolutionary, and it had a big impact on the community in Seattle. And so I've been looking at different sources that relate to that. I've also been looking at how compassionate care, hospice, that kind of palliative care can, the quality of it, if it can lead to better outcomes or not. That's kind of a hard argument with AIDS patients, considering that for the first few years, the disease was almost always fatal. But, there is a degree of comfortability that can be achieved in a positive environment. And I've also been arguing that the Bailey Boucher House helped manage the crisis in Seattle by providing a comfortable, safe place to spend one's last days. And that kind of ties into the impact it had on the LGBTQ community at the time and the response to the AIDS crisis in Seattle as a whole. So, my sources, I have really enjoyed looking at a variety of different interesting sources. One of the first ones that I found was the Seattle Civil Rights and Labor History Project, which just kind of looks at different events in Seattle's history related to civil rights and labor history, and the AIDS crisis happens to be one of them, and they have a lot of really awesome oral histories, kind of just recordings and records of people who were there and other types of things relating to that. There's also a couple of Bailey Boucher documentaries on YouTube created by Virginia Mason, who is the operator of Bailey Boucher House since the beginning. And those are really awesome. There's a screenshot from one of them here. Chris Hurley, former executive director of Bailey Boucher House, when it opened. And so those are really awesome because they're essentially just like an hour or so of straight oral history, primary source, which is awesome. I've also been looking at medical journals covering end of life care standards. That's the kind of top banner there. Those have been helpful in my arguments that the Bailey Boucher House was really impactful on the community, medically and kind of as a whole. Public records and statistics have also been really useful. That's what that screenshot is from that says HIV/AIDS surveillance on the top. The CDC put those out every 6 months, and they kind of give case numbers, infection rates, projections by state and by large cities. So I do get them for Seattle, which is really awesome. So those have been really helpful in tracking the development of the disease. from a reliable source such as the CDC. And then the last one is the Saul Bromberger and Sarah Hoover Photography Project. And the two of them were in residence at Bailey Boucher House for about 3 years total. And they kind of were the photographers, documentarians of the facility, and they give a really unique look into what it was like at the facility unless you were there. Unparalleled, I would say. And that's what those black and white film photos have been in this presentation so far. I might go back at the end and look at them again because they are really speak for themselves, which has been awesome to look at as well. And there's a hour-long interview on YouTube with them explaining their photos and what it was like. So that's been also really awesome. All right, so the significance, greater impact of the Bailey Boucher House and everything I've been looking at. One thing I have been arguing for is the positive community impact. What the Bailey Boucher House provided for Seattle was really unique in that it was a safe place. It wasn't, a hospital, because a lot of hospitals and other hospice nursing facilities refused AIDS patients, which left them with nowhere else to go that would be providing around-the-clock medical care. The community also came together in an extremely unique and forthright effort to get the Bailey Boucher House off the ground, built, operating within 5 years, which is pretty incredible if you ask me. The Bailey Boucher House is also significant in the larger LGBTQ plus movement because it was serving gay men of color, those who were hit hardest by the virus when it first was really strong and at the early years of the epidemic. And so that is also significant because the Bailey Boucher House was a safe place to go. They didn't discriminate. They were affordable. That was one of their goals from the beginning, was to make it accessible to anyone that needed that kind of care, which also ties into kind of what the facility has become now, because since AIDS treatments have been more available since 1995, there's been less of a demand for AIDS hospice facilities since it's not nearly as fatal. And so the Bailey Boucher House has become an end-of-life care facility for other chronic illnesses like ALS. And so the facility is still up and running today and still is having a great impact on the Seattle community. And also the last thing I've been looking at, or that I'll talk about, is just the monumentally successful, you could say, management of HIV/AIDS in Seattle. It really is different than harder hit cities. The response was almost immediate. Upon learning of the first few cases in the city in 1983, the city council immediately started setting aside funds because they knew that they would need them. And so I'm just also looking to tie Bailey Boucher House into the larger kind of impact of the management of HIV/AIDS and how Bailey Boucher House was just another facet of why Seattle was able to manage the crisis more effectively than other places. All right, so my last slide is just a couple more photos. I might talk about the first ones first. So this photo is the facility covered in heart balloons, maybe Valentine's Day, I'm not quite sure. But you can see the facility and how it has a really unique build to the complex. Lots of outdoor space, lots of private gathering spaces like the solarium up there, the little tower on top. Those were in mind when it was built and designed because they wanted there to be spaces for, someone to meet with a family member or a loved one or just have a quiet moment alone. And so all that kind of compassionate above and beyond care was tied into the facility from the start, which was achievable because it was built from the ground up and could be designed and wasn't taken over. They didn't buy a nursing home, they built their own, which is unique. These photos show some maybe happier moments amongst the grief and hardship that was going on. Two patients here family visiting and nurse interactions, which from the photos seem to be really positive. I know that the staff and the volunteers were all really committed and became very close with the residents, not the patients. They called them the residents because they didn't want to make it, feel too hospital-esque. Um, Here we have top right, a birthday party, which to me really highlights the dichotomy between life moving on, trying to celebrate the little things, and a visibly gaunt and ill patient who maybe is wondering, is this my last birthday? But those kind of moments were always present, and present in these photos, that even if there was a happy moment, there was always, an underlying tone of, we are in a hospice facility, but that doesn't mean that there weren't happier moments. Um, Bottom left, we have a group of people grieving, looks like it might be at a memorial. And then bottom right, another common scene, which is someone being carried out on a stretcher after having passed away. Also very common, especially at the height of the epidemic. Someone might only last for a couple days as a resident, and then they would move on. Okay, photo slide. Top right, we have a resident suffering from AIDS and his partner visiting. One thing that was hard that a lot of the staff talk about is that they might have someone come in and be a resident for a few months and pass away, and then have to treat their partner a few months down the road, which is incredibly hard for the staff. Bottom left, there is a nurse and a patient. As you can see, they're all very close. They know each other very well. You can also see what the rooms looked like. They all had a bed and a sofa, and they were just designed to feel really homey, comfortable, with enough room for visitors, with enough room to also receive, life-sustaining care if needed, which was really awesome in the design of the facility. Top right, also a common scene, is someone's room being cleaned up after they've passed away, which was common and also probably very difficult for the staff. And to end on a lighter note, the bottom right is a Christmas celebration, singing carols. Those types of kind of community celebrations were very common in the facility to kind of boost morale, kind of instill some feeling of normalcy, and also to just get everyone together and out of their beds if they felt like it, and make them feel slightly normal as much as possible. Alrighty, so sounds good. Thank you so much.